The Biden administration and government health officials are trying to get Americans on board with the latest guidance on COVID-19 booster shots. An independent FDA advisory panel studied the Pfizer vaccine, and on Friday it recommended a booster for Americans over the age of 65 and those at risk of serious disease. The booster should come 6 months after the first dose. But that same panel voted not to recommend the booster for everyone else. In the same week that the panel made its recommendations, the virus killed nearly 10,000 Americans. And the doctors say it's the unvaccinated that are dying. In all, the COVID-19 death toll in the U.S. is more than 673,000 people. CBS News national correspondent Mark Strassman is in Orlando with more.
Instead of widespread boosters, the Biden White House got a shot of rejection. An FDA advisory panel on Friday recommended Pfizer boosters only for vaccinated seniors and high-risk patients, a decision making a challenging process even more so.
If you want to roll out booster shots to the population, you can't flip a switch and make that happen overnight.
Not in COVID America, where the virus now kills around 1,900 people a day, the highest average in 6 months. By any measure, COVID sorrow stalks Florida with a vengeance. More than 50,000 Floridians already dead. An average of 350 more every day tops in America.
We got to manage our behaviors. We got to get vaccinated.
Dr. Vincent Hsu, an infectious disease physician, works at Advent Health Orlando. System-wide, Advent Health has 50 hospitals with 1,700 COVID patients, more than half of them in Central Florida.
There's still a lot of issues with taking care of these patients, supplies, space, as well as staffing.
Continuous surges remain a threat?
We always have to be prepared for another surge.
Critics blast the state's leadership for failing to protect the youngest Floridians.
The decision to try to keep kids in school was the right decision. The decision to let the virus spread the way it has and not even employ mitigation in the school as they're doing now, I disagree with that decision.
Pandemic politics surge blood pressures across the country.
No more masks!
In Ohio, state lawmakers threatened to block any mask mandate the governor tried to issue. And like his reaction,
every single county is red hot. Some counties are almost boiling over.
At the United Nations, the global worry, a potential super spreader event starting Tuesday. New York City has a vaccine mandate for conventions, but the UN has no power to enforce it.
We as Secretariat cannot tell a head of state if he's not vaccinated that he cannot enter the United Nations.
This hospital, Orlando's largest, is short hundreds of nurses, despite retention bonuses and shift bonuses. And it's a crisis across America's hospitals. Early retirements, resignations, and a rash of sick days. Staff burned out by this ongoing COVID siege.
Joining me now is Dr. Gita Swamy. She is the Associate Vice President for Research and a Professor of Obstetrics and Gynecology at Duke University. Dr. Swamy is part of the independent FDA panel that made the recommendations. However, I should note that she was not part of the final decision because she was working on studies connected to the recommendations. Dr. Swamy, thank you so much for being here. Tell us, do you feel that the panel's decision is causing confusion?
Thanks for having me this afternoon. And, you know, it's a tough question to answer because the panel is really looking at medications, vaccines, drugs, and so forth from the perspective of the FDA, from how we look at things related to approvals and licensures for medications. That combating against the issues of the pandemic, how do we control the disease, but also thinking mostly about those who have the highest risk of complications, hospitalization, and so forth. So there are some nuances to it, but I understand completely how it is raising a lot of questions and concerns.
Well, one of the questions is about who exactly is being recommended to get it. The panel recommended a booster shot for people over the age of 65 and people at higher risk of complications. Does that at-risk group include pregnant women?
It's a good question. So it's unclear at this point because remember, right now, this is what the VRBPAC panel has given their advisement to FDA. FDA will still have to make some of their own decisions internally, and then the CDC, as far as the Advisory Committee on Immunization Practices, or ACIP, has to make recommendations thereafter. From the standpoint of pregnant women, the American College of Obstetrics and Gynecology is in lockstep in communications with all of our federal partners as well to think about that. But we know hands down that pregnant women who are unvaccinated are certainly the group at highest risk for complications of severe disease and being hospitalized. But to date, pregnant women have been included in other prioritization groups. When we first started out almost 10 months ago with vaccination and so forth, they have been included as a high-risk group. So it's still up for discussion, but I'm hoping that that will be the case given the significant complications we've seen in pregnant women and their infants.
So as an OB, it sounds like you would recommend a third dose for one of your pregnant patients. Is that right?
So I would, based on what I know about the vaccine, based on even the information that was given to the FDA from Pfizer, the concerns that were raised by the committee, the advisory committee on Friday, were really about long-term effects. Do we know that this will be enough to prevent disease? Do we have any concerns about safety? But if you look at the data so far, even among those who have been getting a third dose now following the boosters for those with immunocompromised conditions, we haven't seen any safety concerns. We're not seeing a higher incidence of, say, fever or body aches or all those side effects immediately following vaccination. And there's been nothing to date of concern from women who have been pregnant or women anticipating pregnancy to get vaccinated. So I really do think that we're looking towards a booster dose as being the best way forward.
So it's great to hear you say all those things. I'm wondering, especially as we're talking about your specialty, obstetrics and pregnant women, are you still seeing much vaccine hesitancy, even when it comes to that first or second dose?
Yeah, unfortunately, yes. And it's a tough situation. We're seeing vaccine hesitancy across the board, right? All people, particularly in this country, have faced these decisions, without data to start with. And then as things have gone forward, we've gotten more and more data, but it can be hard to overcome those initial concerns and questions that are raised. There is still a lot of misinformation out there, and I think still a lot of lack of trust and understanding. To be quite clear, there have been now several hundreds of thousands of pregnant women in this country who have gotten vaccinated, and we have not seen any concern about their own health or any concerns about the outcome of their pregnancy or the health of their newborn infants. So there is really no medical reason to have a concern about the vaccine if you're a pregnant woman or even if you're anticipating getting pregnant.
I just want to underscore that point. You said hundreds of thousands of pregnant women have been vaccinated, and to date, you have seen no serious adverse reactions to that.
That's right. That's exactly correct. So we know from the CDC's VSafe pregnancy registry that they have followed several thousand women directly, collecting outcomes and information from them. We know that individuals who have used that application to register that they've gotten vaccinated is somewhere well over 160,000 or so. And we know that's underreporting, right? Not everyone out there who got the vaccine registered for that to use that mobile app. We know this data coming out of Europe. We know it coming out of other countries and so forth. And quite frankly, it's the opposite. We're seeing higher reports now of higher adverse outcomes among unvaccinated pregnant women being admitted to the ICU, requiring very serious critical care interventions, even beyond mechanical ventilation or something called ECMO, which is essentially cardiovascular bypass. And we're even hearing reports out of the Southeast, where we know we have the highest unvaccinated population, women having a preterm birth and even stillbirths or fetal deaths. So there is nothing to suggest that the vaccine causes any harm. And actually, we have data suggesting the opposite. Without getting vaccinated, we're very concerned about the outcomes of both women and their newborn infants.
Very important conversation. As we know, those people are really trying to make the best decision for their unborn children. So, Dr. Geeta Swamy, thank you for joining us, and thank you for all that you do.
Thank you so much.